thank you so much. And I'm grateful that hopefully my team's listening to this as well, because you were going to speak with us on Tuesday, but your son had a swimming carnival, plus we knew you were coming today. So I hope you did well in the swimming carnival.
Thank you.
And they didn't get flooded out. All right. Well, thanks, Kasey. Over to you, if that's all right.
Well, I've actually put together a PowerPoint presentation, so I'll talk to my slides. I'm just going to share my screen with everyone. There we go. I hope everyone can see that.
That's great.
Well, firstly, thanks for attending the session today. As you know, my name's Kasey Mumford, and I'm a director at both Southern Cross Cannabis Clinic and Provocatus. And I feel really privileged to be able to talk to everyone today, and look forward to spending the next 25 minutes unpacking the work that we've been doing amongst ADF veterans in the medicinal cannabis space. I understand there's some question and a discussion time at the end, so I look forward to taking your questions and discussing any other aspects that I might not have covered, or things that you think of along the way. Just what I'll cover this morning with you is I've broken the session into two. So the first part of the session, I'll focus on Southern Cross Cannabis Clinic, which is a specialist pain management clinic focusing on medicinal cannabis treatment. I'll talk about the foundations of the clinic and our work with particular relevance to our veteran patients, and what our data is telling us about this treatment. During the second half of the presentation, I'll focus on Provocatus, which is a veteran-owned medicinal cannabis supply business. Once again, I'll give you some background to Provocatus before I outline the work that we've undertaken to establish a program to reduce medicinal cannabis treatment barriers for ADF veterans, and how veterans can connect with that program. And then I'll conclude the session today just with some information about how you can connect with both Southern Cross Cannabis Clinic and also Provocatus. That's me there on the it's on the right of my screen, and that's my husband, Dr. Michael Mumford, there on the left. And at this point, I do need to talk a little bit about Michael. It's a package deal, so just bear with me, because really this all started with him. So Michael and I are both ADF veterans ourselves. Michael served for 20 years in the Army, and I served for 15 years in the Royal Australian Navy. After Michael finished his initial training, he joined the Royal Australian Engineering Corps before embarking on a career change in 2008 when he started studying medicine. After he left the Army in 2018, Michael started practicing medicine at a general practice in Dapto, which is where we're still located. For those of you who have never been to this area, Dapto is traditionally a low socioeconomic area. We're located about 15 minutes south of Wollongong in New South Wales. And because of the nature of the area we're in, Michael's patient base included a number of chronic patients who had been managed for lengthy periods of time on a variety of addictive pain medications. Also around this time, a handful of Michael's former soldiers who had since discharged from the Army had located him, and they started to see him as their GP. Michael noticed that the management of his patients, including his veteran patients, was becoming increasingly problematic due to the nature of their conditions and the medications they were taking. And that led him to start exploring some other treatment options, and ultimately to an interest in medicinal cannabis. In 2019, we launched our own general practice, Medical Professionals Dapto, and we reserved 1/3 of the footprint of the practice during our fit out for on-site allied health. However, by 2020, through word of mouth alone, really, the demand for medicinal cannabis services had rapidly grown. Notwithstanding that, our medicinal cannabis patients were telling us about the difficulties that they were having accessing treatment, And we heard stories about patients being charged exorbitant consultation fees, for example, in clinics in Sydney, and the difficulties that they were having generally in trying to find a doctor to prescribe them medicinal cannabis. That led us to abandon our original plans to incorporate allied health at the practice in favour of a dedicated medicinal cannabis space, which we've since called Southern Cross Cannabis Clinic. We continued to grow Southern Cross Cannabis Clinic within the confines of Medical Professionals DAPTO while we have been awaiting completion of our fit out. And our fit out is now about 90% complete, and we're in a position to start moving into this space, which we'll be doing over the next couple of weeks. We have certainly faced some opposition to Southern Cross Cannabis Clinic and to medicinal cannabis treatment more generally. We regularly hear from doctors that there isn't enough evidence to support the efficacy of medicinal cannabis treatment, and there is still very much a stigma around medicinal cannabis that all it is really doing is legitimising the habits of drug users. But through what we've confronted and our experiences, all that's done really for us is just confirm that there's a great need for better education about medicinal cannabis treatment, both publicly and also within the medical fraternity. And that's really cemented our overall position, which I've written up on that slide there, you can read, that access to medicines that alleviate suffering is a human right and a medical responsibility. And patients suffering chronic pain should have equitable access to medications that are legal and have been appropriately prescribed by a medical doctor as part of the overall care of the patient. While the majority of our patients are non-veterans, since launching Southern Cross Cannabis Clinic about 16 months ago, veteran patients now constitute about 20% of the total number of patients we see, and that number is growing. Of that number, 94% are male, and the vast majority of these men are under 50 years of age and do reside in New South Wales. We have a growing number of patients who also reside in Queensland, and we have a scattering of patients who live in Victoria, South Australia, and in Western Australia. We're able to see patients across Australia via video health. That's specific for DVA patients. We're not able to see non-DVA patients by video health. So our non-DVA patient base mostly reside within travelling distance of the clinic. And I should also add here that because of our military background and our desire to assist the veteran community, we've made a conscious decision to prioritise veteran patients, and we bulk bill all of our DVA patients as well. Last year, we connected with the Graduate School of Medicine at the University of Wollongong to launch a research project using our clinic data. And the purpose of that project is to examine whether medicinal cannabis treatment can result in the deprescribing of addictive pain medications such as opioids, benzodiazepines, and antidepressants. The project will also inquire into the quality of life indicators of patients who are undergoing medicinal cannabis treatment. While the data that we've provided to the University of Wollongong encompasses both veteran and non-veteran patients, we have done a separate analysis on our veteran patients, which I think you might find interesting, and you can see the results of that analysis there on the slide in front of you. That analysis that I've done focuses purely on deprescribing. The patients included in the analysis all commenced treatment prior to the 1st of December 2021 and have continued with their treatment to date. And after applying that exclusion criteria, the total number of patients captured in the analysis is 42. And they comprise of 39 male and 3 female patients, and the average age of those patients is 42 years of age. What that data is telling us is that since commencing medicinal cannabis treatment, these patients have experienced a 71% reduction in opioid consumption, and that's based on a morphine equivalent, and an 89% reduction in the medication Lyrica. We were not able to convert Lyrica to a morphine equivalent base, so we just left it out there on its own because it's quite a prominently prescribed opioid. The patients have also reduced their consumption of benzodiazepines by 53.5%, and they've reduced their antidepressant medication by 41%. Importantly, it was also noted in the analysis that patients who commenced medicinal cannabis treatment on no other medications tended to be tolerating their conditions, but were aware that their quality of life was deteriorating. So they were seeking a natural therapeutic treatment option. And since commencing medicinal cannabis treatment, none of these patients have resorted to any other form of pain relief. Although that analysis is limited to DVA patients, it's really positive, and we're hoping that there'll be similar outcomes replicated with the UOW research project. Now on to Provocatus. Provocatus is an Australian veteran-owned medicinal cannabis supply venture. It's also based in Wollongong, and the company was launched in mid-2020. We've partnered with a number of individuals to launch Provocatus, one of whom is James Gatley, who's our managing director and is also himself a veteran. Medicinal cannabis in Australia is still very much an emerging industry, with all of the growing pains that you would expect in a developing product market. So the reason we decided to launch Provocatus is because as a prescriber, Michael experienced issues in product supply. That is, companies running out of products and changing product lines, with fluctuations in cost. And also there were issues with quality. There are a lot of international products on the market that are being sold domestically that don't comply with Australia's good manufacturing practice. And at the end of the day, all doctors want to make sure that the way they're treating their patients is the best way and in the patient's interests. Because of the experiences of Michael, we decided that the best way that we could achieve that level of assurance while the market is still maturing was by doing it ourselves. So we've now got a range of oils on the market. We have CBD and THC only oils, as well as blended oils. And we've recently added 2 flower products to our line as well. So that gives us a broad range of products to be able to treat patient conditions. I should add that Provocatus products are classed as Schedule 4 and Schedule 8 pharmaceuticals, and therefore they're only available by a doctor's script. A key initiative for Provocatus since its launch, it has been the establishment of a compassionate access scheme for veterans, and that access scheme, which we've called the Veteran Access Scheme, commenced on the 21st of February. One of the things we noticed since we commenced medicinal cannabis treatment amongst veterans is that the requirement for a veteran patient seeking medicinal cannabis treatment differs to any other Australian patient. For example, there's a requirement for a veteran patient seeking medicinal cannabis treatment to have a pain specialist support this treatment option. And finding a supportive pain specialist who doesn't have an extensive wait time is not an easy task. Because medicinal cannabis is still an unregistered medication in Australia, that also means that veterans seeking medicinal cannabis treatment need to find a doctor who is conversant in both the TGA Special Access Scheme and also the DVA application process. And once again, we've heard all sorts of reports from veterans being charged really excessive assessment fees, which not only leaves them out of pocket, but don't actually mean that they're any closer to commencing treatment. For non-veteran patients, there are over 100 recognised conditions that the TGA will approve medicinal cannabis treatment for, including mental health conditions such as PTSD, anxiety and depression. However, as it stands, DVA does not support medicinal cannabis treatment for veterans on the basis of a mental health condition alone. All of those factors represent barriers for veterans seeking medicinal cannabis treatment, and in our view, they've created a health equity issue for veterans. And it's for those reasons that we decided to set up the Veteran Access Scheme. The purpose of the Veteran Access Scheme is to alleviate the medicinal cannabis treatment barriers facing veterans by expediting access to treatment and reducing treatment cost while they await the DVA claims process to take effect. Importantly, the program is a stopgap measure to the DVA claims process. So what we're seeking to do is to work collaboratively with DVA to improve their existing processes. The program has a strong education focus, so it's anticipated that that will also improve medicinal cannabis prescribing and application literacy amongst doctors, which will mean that we're able to create a pool of better skilled doctors to assist DVA patients in future. And the program also presents an opportunity to bring awareness to veteran health issues, which is timely given the Royal Commission into Veteran Suicide. So the program model, there's the diagram there in front of you, and they've all been important factors in bringing the program to life. So we have received industry funding for the program. So I'm just working around in a clockwise direction there to the governance part of the pie chart there. We've engaged Omni, who are also a veteran-owned business, and they're a great business. Their core offerings include security, intelligence, and training solutions, and they're providing that governance support and the assurance to the program. We've got products that are supplied from ourselves and also Can Group, who are the largest medicinal cannabis company in Australia. They're headquartered in Victoria. And that takes into consideration not only the oils and flower products of Provocatus, but capsules. And that gives the doctors a full range and flexibility in treatment plans. And once again, we have that assurance that the products are all GMP certified, so that means they're of the highest quality. For pharmacy, we're using one pharmacy for the program, Dapto Centretown Pharmacy, who we work with a lot, and that's really important because, as I mentioned earlier, medicinal cannabis is a unregistered product in Australia, and what that effectively means is that pharmacies can charge whatever they want. It's not uncommon for there to be a price variation of $100 between products at different pharmacies. So we've always found Dapto Centretown Pharmacy to be very ethical in their pricing. They understand the products and they have experience dispensing products across Australia as well. Southern Cross Cannabis Clinic will provide the doctor education, and in terms of marketing for the program, we've got a number of engagements planned. We've already done a few things, but we really see a great benefit in developing our relationships with other organisations who are also focused on veteran health. Just very quickly there, for the program eligibility, to be eligible, a patient must be a veteran, they need to be a client of DVA, and they have to have a DVA recognised condition that causes chronic pain, a mental health condition, or both. We've set the program up with two pathways. Pathway A is for chronic pain patients, and Pathway B is for patients suffering from mental health conditions alone. So for Pathway A, the scheme will provide nighttime and daytime products with a repeat script, and that should last the veteran for about 12 weeks, which will allow enough time for the DVA claims process to take effect, and that's up to a maximum value of $1,000 for the patient. And then for Pathway B, the patient will be required to pay 50% of the product value, so it's a subsidised pathway, and they will need to submit a new application to the scheme every 12 months to receive those products again. Remembering that DVA will not cover medicinal cannabis treatment for a patient suffering from mental health conditions alone, Pathway B has been set up to provide veterans an opportunity to access treatment for mental health conditions at a more cost-effective rate. Okay, so how does it work? The first thing the patient needs to do is to review the Veteran Access Scheme patient information form and take that to their GP to discuss treatment. And that form is available on both the Provocatus and the Southern Cross Cannabis Clinic's website. The doctor will then make an assessment of the patient, and if they agree that medicinal cannabis is a suitable form of treatment, then they will need to locate the application form on the doctor's portal in the Provocatus website. There's a QR code and a link on the patient information form to take them straight in there. And then that doctor's portal also has a lot more information about the Veteran Access Scheme. It has product information and details about the education and support available. Then the application process is managed by Omni. So if it's approved, then a letter will go back to the doctor and the pharmacy, which will allow the products to be dispensed. If it requires more information, then Omni will write back to the doctor and say we need more information. Really, the only way that the program, a patient could be declined on the program is if they're not a veteran or not a client of DVA. There are a couple of ways that you can support the program. Firstly, I'd encourage you to talk about the scheme within your networks, and also to disseminate the patient information resource, or to know how to access it so that you can disseminate it. And that brings me to the end of the presentation. I've just popped some key contact information up there for you. So there's the website addresses for Southern Cross Cannabis Clinic and Provocatus. For patient referrals, doctor support and education, and any general inquiries about medicinal cannabis treatment, they can be directed to Southern Cross Cannabis Clinic, and there's the email address for Southern Cross Cannabis Clinic there. And for any other information that you might need about the Veteran Access Scheme program, there's the vas@omniexec.com email address there. Thank you for taking the time to learn about our work, and it's been a pleasure to talk to you, and it's a pleasure to be able to support our veteran community. If you've got any, if you need any more information, please feel free to use those contact details or to reach out to me. Thank you.
Kasey, thank you so much. And just encourage everybody, if you've got questions from this session, please write them down. And when we move into the discussion, you'll be able to ask Kasey directly and really talk that through. So can I thank my colleague Louise for jumping in as the host. We found them in Concord. We've got them connected. They haven't been washed away. So it's my great pleasure to welcome Johanna Castle and Bronte Pollard to talk about the work that they are doing. And so, folks, I will get you to start your microphones and your cameras, and you are on.
Great. Yeah, sorry, IT fail. So I'll get started with our presentation, and Bronte is also going to be joining me. So I'll share my screen here. So my name's Jo. I'm a case manager at the National Centre for Veterans Healthcare. So my background is I'm a community mental health occupational therapist, and there's 3 case managers at the centre. Bronte?
Yeah, my name's Bronte Pollard. I'm with RSL New South Wales, and my role is liaison officer to the National Centre for Veterans Healthcare. So I basically work in a non-clinical role, taking referrals from the case managers who have veterans who might need assistance with supports outside of the medical realm. So, you know, might be directions to claims and advocacy, social supports, et cetera, et cetera. So that's pretty much my involvement.
The
National Centre for Veterans Healthcare is located in Sydney at Concord Hospital. We provide a holistic approach to caring for Australia's veterans to treat their mental health, physical health and psychosocial needs together.
When a veteran comes to the NCVH, they are linked with a case manager and specialised clinical services are delivered by a team of health professionals. It's all about providing care and support specific to each veteran and their family's needs. Medical and allied health services include pain management, rehabilitation medicine, mental health psychiatry, drug and alcohol, psychology, exercise physiology, physiotherapy, dietetics, social work, diversional therapy, occupational therapy.
If you have served one day in the Australian Defence Force and are no longer serving, you are eligible for treatment. All you need is a Medicare card and a referral from a GP.
No, veterans can come to the NCVH with or without a DVA card. We are a public health service. All you need is a Medicare card.
NCVH is open to veterans across Australia. Please give us a call to talk about your circumstances. There are travel and accommodation options to support you and your family.
Your NCVH case manager, clinicians and GP will work with you on an ongoing care plan and connect you with services to support you in your local area.
You can call or email and speak to one of our case managers for more information.
We have rehabilitation medicine, drug and alcohol psychiatry, pain management and mental health psychiatry. And under each one of those medical specialties, we have a psychologist. So we have a drug and alcohol psychologist, a couple of mental health psychologists, a pain psychologist, and also a neuropsychologist that can do a lot of cognitive testing and things like that. We have a case management team. So when veterans come onto the service, they'll be allocated a case manager, as well as the wonderful addition of Bronte, our RSL liaison officer, and he'll talk to his role in the service a bit later. We also have a raft of allied health professionals, physiotherapy, exercise physiology, occupational therapy, diversional therapy, nutrition, dietetics, and social work. And we all work under the one roof. So it's sort of like a one-stop shop, we like to call it. So we basically have seen over the last 2 years, we've been open, veterans coming to us aged between 20 and 77. So there's no real sort of exclusion criteria. The majority that we are getting are from Sydney Metro and the Greater Sydney region. But just because I think that's because we're located in New South Wales, but we have had referrals from Victoria, Tasmania, Northern Territory and Queensland. So we do say we're a national service and we hope to build on that as we progress. So the mental health, the treatment we've seen veterans come to our service have been predominantly the 4 medical specialties we originally planned for, which was great. So mental health, drug and alcohol, orthopedic, and musculoskeletal conditions, as well as chronic pain. Because we're part of a large hospital, we're a public health service, as that video said, we do a lot of referrals. We like to say we're whole persons. So regardless of whether you have accepted conditions or not, we can just bill you through, or just put you through the Medicare system. Actually, we don't bill anyone, but put you through the Medicare system, and we can get you referred for audiology, respiratory, sleep studies, all your scans and pathology will be done on site. So you're not running around the community trying to follow up any referrals that the doctors might give you. We do it all while you're with us. Bronte had collated some stats for us. So as of July last year, we had 42 referrals from the Navy, 59 from the Army and 6 from the RAF. So we've about doubled in size from that, but I would say the ratios are about the same. The Army is the greater proportion of referrals, but certainly Navy aren't too far behind, and less we find from the Air Force. So the case manager's role is really to answer any inquiries. So people just ring up, veterans and their families ring up randomly, and even can ask for, do we know a physio? So that's not really appropriate for our service, but we certainly will help the client, help the veteran that rings find a local physio. We'll just Google and help them find whatever services they need, regardless of if they start with us or not. The case managers also process the referrals and do all the intake with the veterans. And then the veterans get allocated a case manager, and you all have our direct mobile numbers, so you don't have to ring the hospital and go through the hospital phone system to find us. And we'll coordinate all the veterans' care and appointments. We'll be the single point of contact for the veteran and their families or support peoples, and any other external services that might be involved, like caseworkers or rehab providers or anything like that. And we don't do any reporting back to DVA unless the veterans ask us to. So we're completely independent of that system. The length of stay with us, it's all outpatient, so people come in for appointments, is between 2 to 4 months. We have been doing a combination of like telehealth because of COVID, and we do that, and that was built into our service anyway because we were a national service. So at the end of that, about midway between that 2 to 4 months, we start looking at, what referrals can we make into the veterans' local community? So physio and exercise physiology, we normally kind of do first because there are a lot more of those in the community. Start getting the veterans to slowly start to find treatment options in their local areas. We help them do that, as well as any other services they need, such as like psychology, which is sometimes hard to find, dietetics, any of those other services have been seeing with us. If, say for veterans seeing psychology and they've got something longer they want to work on, maybe a bit of trauma stuff or what have you, they can stay on for single service for a bit longer. Or if we're struggling to find a community referral, especially if you live rural and remotely, we'll hold on to the veteran for a bit longer until that does happen. So there's no kind of cut off. Once you hit that 4 months, you just can't come to us anymore. We do also, a really important part of our service is our diversional therapist, Rachel. So we don't want the veterans' lives or anyone's lives, that for that matter, to be only revolving around medical appointments. So we do a lot of psychosocial referrals. Rachel works with the veterans to talk about, activities and hobbies and things that will give you meaning and fill up your spare time, and basically have that link back into the community. So we've referred people to sailing, archery, just any type of volunteering, yoga, working with horses. It just really depends on what goals the veterans want to work towards. So Bronte, this is your bit now.
Okay. Here we go. Okay. If I can just begin, and I just want to say to everyone that serving veterans is an absolute honour, and working with the team at NCVH is just absolutely amazing. It really is an Australia first, if not world first, service where veterans care is case managed, and it's a holistic approach. It's not just coming in and fixing a dodgy back when they come in. The team there look after them, and as I said, it's just an absolute honour to work with such amazing professionals. So my role, I've been in this role now for about 12 months. It's a RSL funded initiative, came out from a suggestion from the grassroots, from the centres, and it operates under an MOU between RSL New South Wales and Concord Repatriation General Hospital, which, following from the Second World War, has a long history of supporting veterans and their families. Currently, I work on site about 2 days a week. That's a moving feast depending on where we are with COVID. My email I monitor daily, so I'm always there for if the case managers reach out, and then once I do start assisting a veteran, I'm able to follow on and keep that support going there. So what are the key sort of roles and things that I do? So directed by referrals from NCVH. I'll just clarify, I don't see every veteran that goes through NCVH, but if the case managers during the intake process feel that there's some non-medical, non-clinical assistance or support they might need, they refer them to me. I'm a jack of all trades, master of none, and I'm happy to chase down any support. I don't do claims and advocacy or any type of thing myself. I'm really just a connector of services and helping them navigate where to find them. I provide resources and education for RSL sub-branches and ESOs. It's important to point out my role is agnostic, might be funded and I might wear the RSL badge, but I work with all ESOs, and when I refer to services, it's whatever service is going to best meet the client's needs in where they're located. So that's very, very important to point out. I'm also a point of contact coming back the other way for RSL sub-branches and ESOs wishing to refer veterans into the service. They might, some feel more comfortable talking with me. It's also a good, I like doing that because it takes the load off the case managers who, are looking after and scheduling medical appointments for the veterans. And the other thing that I do is just through my networking and being out in the veteran community, I get a number of people just coming up and going, look, can you help me? How do I get into the service? And I'm more than happy to help guide them through the process, fill in the paperwork and direct them into the service. So that's pretty much in a nutshell what I do. Just in terms of the last 12 months, so I think, Joe, correct me if I'm wrong, but we had, in a pandemic year where there was a 4-month lockdown and service suspensions and what have you, we had over 120 clients come through NCVH, and 58 of those were referred to me for some form of assistance. Now, it might have been just one phone call. There's a handful of veterans that I've been, staying in touch with and working with for the last 12 months. So of those 58 referrals, 42 required claims and advocacy assistance, 6 were financial support, 11 were links to ESOs and RSLs, might have been to, Veterans Centre Australia, their local sub-branch, a variety of places. Social supports and activities, as again, I work very closely, like Joe said, with the diversional therapist and, tracking down psychosocial activities. I think Joe mentioned the safe ones. We had one veteran who went into knife forging. I'm not sure if that was a good one, but and peer-to-peer chats, an unexpected thing that I do, but some of the veterans coming in might have 3 or 4 appointments throughout the day. Just having a coffee with them beforehand or just a circuit breaker in between sessions has been great. Hasn't been good for my waistline, but been great for the veterans. And then 22 others, which I should make its own category, but surprising the number of veterans coming in for treatment who, discharged recently or, a long time ago, a variety of periods, but who don't have updated copies, digitised copies of their medical records, which is extremely helpful for the medical treatment and for the claims process. So that's it. Of all those, I broke them into 2 groups. There's veterans who had multiple, so they might have had a combination of 2 or more of those groups, and then 31 of them were just single requirements. So I love numbers, and I think, as Joe mentioned before about the Army, Navy, Air Force, this is based on information that was put into a study, but it just gives an idea of the type of discharge modes, and I think that is very reflective across of the people that are in the service. Sort of half are people who have medically discharged, probably a third who voluntary discharged, and then a very small percentage who were admin discharges and people who just didn't want to disclose. Also, as Joe mentioned, DVA status is very important to just reiterate. You don't need to have DVA status to receive treatment, but with the proliferation of the Veterans Covenant and the pushing out by DVA of the white card for the non-liability mental health, majority of veterans have the white card. So you can see there it's sort of like a 75% white card. There's about 20 odd who have gold card, and there's some who come through who don't have any DVA status at all, and that's another thing. I probably have helped those three obtain their white cards. And then just referral pathways. Again, DVAs, referrals by friend, veterans finding it online, GPs who are aware of the service. Just one thing which we do need to update in that video is their NCVH has been treating people who are still current serving members of the ADF and might be on a medical discharge or transition out medically. So it's another amazing part of the service where they're not just walking out the front gate and going, what the hell do I do? They're coming into the centre, they're getting treatment and getting linked into services in their community before they get out. And then the big three, rehab providers. Other is, again, sort of people who, through ESOs, and then RSLs and ESOs are a big portion of that. As you can see, Open Arms, RSL Defence Care, Homes for Heroes, Veterans, Centre Australia, and RSL sub-branches, to name a few. So that's pretty much me, and what I do. Back to you, Joe.
Yeah, so Bronte's really been sort of an imperative part of our service, because we will often identify at intake that the veterans and referrals and things, they just don't have their claim work up to date and things. So as soon as we identify that, we shoot them off to Bronte and he starts helping them out, or even if we just feel like they're not as comfortable as they could be coming into us, because it's quite confronting dealing with lots of different issues at the same time. It can be overwhelming. So it's nice for them to go off and have a coffee or whatnot with Bronte. So it's been really great. So as part of, because this was a brand new project that New South Wales Health took on and Sydney Local Health District, we did an evaluation of the first 12 months, because how do we know it's going to work unless we evaluate the project? So we identified that there was definitely a need for holistic and patient-centred care in the veteran population. However, there hasn't really been a great deal of research translated into clinical practice to date. So it's always been talked about, but it had never been put into practice. So we know that many veterans have mental and physical health issues, and it impacts them significantly with their quality of life. And also in handing with that, it increases demands on healthcare. So we wanted to have a look at what that looked like. So we did a study with the veterans at NCVH, and they were able to undertake an evaluation about the project and give us feedback. So the method was, we did a 12-month evaluation. We were currently, we completed a pre-start evaluation before they started, and then a 3-month follow-up as well. So we wanted to see if the changes the veterans had made for their healthcare had some long-lasting effects. So it was a satisfaction survey, really. So veterans, it was about, were the veterans satisfied with our treatment? Were the veterans' carers also satisfied with our treatment? Was the GP satisfied? And we also asked our own staff if they thought anything could be changed over the period of time. Now, I've got some pretty little graphs here that you can't see. So for anxiety and depression, in the pre-commencement survey, we had the majority of veterans saying they were moderately or severely anxious. And at the 3-month post finishing up with us, it was more about, more veterans would say they were not anxious at all or slightly anxious. There was still a couple in the moderate to severe, but nowhere near as to what we saw before they started. In the pain and discomfort surveys, most of the veterans prior to starting had moderate to severe pain, and then at the 3-month post-completion survey, most of those people fell in the no pain, slight to moderate. So we saw a big improvement in the pain and discomfort too. The conclusion of the evaluation was that the integrated care that we provided the veterans really did demonstrate effective delivery of our service, but it addressed lots of the veterans' needs. So coming from medical, psychological, physical, and social as well. And there was reported to be a high level of satisfaction within the cohort of the volunteered to be part of our research. So the other exciting thing our clinic has is on-site accommodation. So about 3 years ago, DVA gave us $6.7 million to fund a redevelopment of a building, which provided on-site accommodation for NCVH patients and also their carers and their families. So this has sort of been on and off open just due to COVID, but we have had rural families come, and family of four children came, and this was the first time they'd actually ever really even stayed in a hotel-like accommodation, because they are serviced apartments. It's not like a hospital. So the clients get to stay there with their families while they're getting treatment. So Bronte's sharing the slides here, so that's nice. So it's Fussell House. It's right next to our building. So that's the main communal area. It's got wheelchair access, multiple eating areas, and activity spaces. There's a separate room for media. So if there's kids or adults that want to watch movies and it's sort of loud, they can go into this room. The bedroom suites, we've got 19 rooms altogether. So as you can see, that doesn't really look like a hospital, which is our main aim. All the bedrooms have kitchenettes. They all have swipe card access. And there is a variety of twin, single rooms and family rooms. And we also have a second floor. So if there's veterans that don't want to have the noises of kids around or loud noises and things, we put them up on the second floor. We do some groups in there, some cooking. We have a Friday barbecue, which is really nice, especially if people are feeling socially isolated, if they live rurally or even in the city, actually. We've got a kids play area, barbecue area, outdoor TV, and that's where we can do some group activities like the barbecues we have. So there's a picture, there's a TV under that timber screen there. So it's been really well thought out, and it's a really nice area for people to stay, veterans and their families to stay while they're getting treatment with us. So they might stay there a week, they might stay there for a month. It really just depends on circumstances. You can come for 2 nights. We're open to working with anyone's situation that they have. So how to refer to us, you can just call us, you can email us, you can get family member to call, any way to find out more information, you're welcome to do that. And we just need a GP referral prior to starting. If veterans don't have a GP, we'll help them get one. So we try and sort of have no barriers to anyone getting treatment. So that's it.
Wonderful. Thank you so much. And just be relaxed, okay?
Oh, this is the first time this has happened.
I know. You made it, you got here, that's all that matters. And I think, Joe, what I might do is I might get you to send your slideshow through when you can, and I'll cut it into the video somehow. Okay, everyone, can we please thank our guests this morning, Kasey Mumford, Joe Castle and Bronte Pollard. Fantastic presentations. We're going to move now to the discussion. So we'll end this session. We'll move into the discussion session. So just click that next one down on your itinerary. And then you will be able to open up your mics, open up your cameras, and you'll be able to speak to our presenters directly and ask questions of them. So folks, thank you so much. It was wonderful. It's just amazing to see the developments in both both organisations. I've been watching you for some time and everything's just really coming along so well, as it should be. Okay, we'll see you in the next session. Thank you.
Thank you.